Okay, everyone, we will just get started. We'll have a couple more providers that are joining in the next couple minutes, but wanted to start by introducing myself. My name is Vanessa Wren. I am the psychologist here at Stanford Children's IBD Center, and I'll be moderating today's town hall. And wanted to just start by welcoming everyone to our first IBD Town Hall Zoom conference. We're really happy that you could join us, and actually that so many of you, we have 40 participants, so we're thrilled that all of you are here. And we organized this town hall in the last week after talking to one of our family advisory council members and really realizing through our conversation with her of how beneficial it would be to have this platform where families could hear from our Stanford Children's IBD team and learn a little bit more about COVID-19, its impacts on IBD, and our medical and clinical recommendations. So we are very aware that this is a challenging time and can be very scary to navigate alone. So before we start, our team really wants to underscore and emphasize that our team here at Stanford Children's IBD is here for you, and we're very dedicated to answering your questions and supporting you through this time. So that's why we wanted to offer this to everyone today. So our main goals are to provide an overview of COVID-19, or coronavirus as it's known, and share our recommendations that are specifically relevant to our IBD patients and families. And so how this will work is that over the last few days, we've actually gathered questions from families in our IBD community here at Stanford, and we're going to be addressing them today. So you do have an ability to ask questions as we go, and given timing and how timing works, we will do our best to address some of the questions that come naturally during this town hall. So before we start, just want to start by introducing our main IBD team, and then we have some wonderful colleagues who have joined us from the Pediatric Infectious Disease program. So if everyone could just take 10, 30 seconds and introduce themselves really quickly, as I know some faces are known to folks joining and other faces are new. So Dorsey, since I see you next to me, could you start and just give a quick introduction about who you are?
Yes, hi, I'm Dorsey Bass. I'm a relatively senior IBD physician with our Ibd Center.
And if we could just go to the right, that would be great.
Sharon, you mean?
Our screen is different than yours.
Yes, thank you. So yes, Sharon, if you can introduce yourself, Dr. Gans.
Sure. My name's Sharon Chen. I'm a pediatric infectious disease physician here at Packard, and I also co-direct with my colleague next to me our immune-compromised host program for the hospital.
Thank you.
Hi, I'm Dr. Hayley Gans, and I'm part of the Pediatric Infectious Disease team. And as Sharon mentioned, we co-direct a program that allows us to partner with our people taking care of people who have immune compromised conditions. So we're happy to be here. Thanks for putting this together.
Thanks, Dr. Gans. Dr. Bensen, you are next on my screen.
Hi, I'm Rachel Bensen. I'm one of the other IBD physicians.
Perfect. And Kaylie? Oh, Kaylie, you're muted. Can't hear you.
I'm Kaylie Nguyen. I'm a nurse practitioner in Peds GI, and I'm so happy to be here to join you today.
Thank you. And Megan, can you introduce yourself as well, as you are instrumental to our team?
Hi, everyone. Megan Christofferson. I'm the IBD Center Coordinator.
Great, thank you. So we are just going to start by today of having our colleagues from Pediatric Infectious Disease program, who just introduced themselves, discuss a little bit more about COVID-19 at LPCH at Stanford, and providing an overview and update of COVID-19 and speaking to a few of the questions that they've received from us before this call. Oh, actually, sorry, before we start, Dr. Goyal, do you want to introduce yourself really briefly? We just went through, just so everyone knows, you are the newest member to our team, and we're very excited to introduce you.
Thank you so much. I'm Alka Goyal. I'm one of the newest members of our IBD team at Stanford. Very excited to be here, and thank you for giving us the opportunity to be here today. Thank you.
Thank you. So Dr. Chen and Dr. Gans, I will pass it to you for a few minutes, and then we will go through some different categories of questions, but we will start with our colleagues in infectious disease. Thank you.
Thank you again for the invitation. I'll start off, and hopefully Sharon, my colleague, will chime in with information of her own. First, I just really want to extend a big welcome, thank our colleagues for putting this together, really reach out to the families. We understand that this can be a really scary time, and so we're really here to support you and to really give you what information you want. Having said that, we don't fully know everything that you want to know, but I'm going to be prompted by some of the information that we do know about the virus and circulation, and then I can turn to the questions, or Anava is going to take us in whatever direction she wants. So I'll just start off by saying thank you all for sheltering in place. We realize this is a very trying time, and I know you have a lot of questions about the health of yourself, your families, and other care members. So thank you for sort of partnering with us and trying to really get a handle of this. As most people, I think, understand, this is a new virus that was introduced into the population not so long ago. So there were some reports in the late fall and early winter of last year, and really starting January, we really kind of understood that this was circulating. So having said that, and the reason I bring that up is because we don't fully understand everything about this virus yet. We are learning along the way. But we here in the United States are very fortunate because we are learning a lot for our colleagues that have already had to handle the situation in a much greater extent than we have. So we have wonderful connections with our colleagues who have been through this in many of the Asian countries as well as Europe. And so we're connected and learning from them. So just rest assured that our colleagues have been a great benefit to us in terms of how to move forward. What I do want to tell you is from what we understand with this virus, and what I would urge everyone to do is not track numbers because I'm not sure that that actually tells us the story about what is happening. And having said that, I'm really not sure it really tells us individually how we are at risk. So I would just urge people to allow us to interpret all the data that's out there, and really we have your health and your concerns at our heart, and we're going to move forward hopefully and try to tell you everything you need to know when you need to know it. Having said that, I would just say, please try not to follow the numbers. I'm going to tell you, having said that, some numbers. So we do know that this virus now is circulating in communities. Like every other virus that happens every year, this virus is going to circulate. And for us in the healthcare, that does not scare us. That's an expected way in which viruses actually live. They go from person to person or animal to animal or however it is. So that's not unexpected. That's why I say number of cases really doesn't surprise anybody. What we really are understanding, which is great for us here in the pediatric, who care for people in the pediatric population, is that all the cases from all over the world have been strikingly mild in the pediatric population, and also strikingly uncommon. And the reason why I know that that is continuing to be the case despite not broad testing, which isn't needed to understand that, is that if people had severe disease, they would show up in the hospital and be tested. And that's not the case for our pediatric populations, which is a great news for those of us who care for children, including yourselves. And what we do understand also, to just extend that to your populations, is that we also are starting to understand that unlike many, many, many other illnesses, this particular virus does not seem to be more severe in those who have any kind of condition that suppresses their immune system. So again, we're still learning, and we're going to pay very close attention to this. And we have very low thresholds for providing care to any degree in our populations that we know can be at risk for more severe disease. And we have queried our colleagues in China. We've queried our colleagues in Italy, which are previous epicenters and continue to have some circulation in Europe. And we really do understand that this is not a disease that a lot of people are seeing in children who have problems with their immune system. So I think that gives us some encouragement. Myself and Sharon Chen and our colleagues are part of a national group that is sharing information about cases, and we will be tracking the cases in these particular populations and sharing our data. To date, we really haven't seen a lot of disease, and we're very encouraged, again, by those numbers. We are screening here at Packard for those people who are coming into our healthcare systems who are symptomatic. And the only reason I bring that up is because we do have our pulse on what is happening in terms of symptomatic individuals. And we know that this virus in particular, where the symptomatology does cross over in a lot of other viral illnesses, is circulating at a much lower rate than other viruses at this time. So I know that a lot of people who get ill are very nervous and scared right now, but I just want to really tell everyone that we are screening for all the viruses that usually circulate during this time, and including this one. And this one really is a very, very small proportion of what we're seeing out there. So having given that background, I think I'll ask my colleague, Sharon Chen, to add anything she would like to say globally, and then Anamba, maybe you'll direct us in questions.
Yeah, thank you.
Thank you, Dr. Gans. I just want to say maybe three things. One is thank you to the IBD team for inviting Dr. Gans and I to speak to not only you all, but to you all, the parents and patients. And second is to know that if by chance you all have questions or do become ill or sick, that Dr. Gans and I work very closely with the IBD team, Dr. Bensen, Dr. Bass, and everyone else on the team. We have already been working very close with them in other situations, and so we will be there for you, and we'll be helping Dr. Bensen and Dr. Bass and others with any of their questions or issues. The third thing, and it's probably said not often enough, and you have seen it in the news and read it in the newspapers and wherever else, is that the one really, really important thing to do is wash your hands.
Great. Thank you, Dr. Chen. Thank you, Dr. Gans. That was incredibly helpful. And I think I'm just going to choose two specific questions just to elaborate a teeny bit more. There's been several questions about does Stanford have testing kits available, as news outlets have reported shortages of these kits. And secondly, are there any medications available for treating COVID-19? Anything different for patients with IBD?
So we have test kits. But we are very prepared. The other thing I should just let the community understand is we're prepared now, and we're prepared for more cases. So I want to really let people know that we're prepared for what's coming. We have a lot of mathematical sort of models about where this disease is going and how many cases, and what our hospitals and healthcare workers will see, what our communities will see. So we're prepared. And we have testing availability for anyone that we feel medically needs testing. We are not testing community people who we feel don't need to be tested. And we are fully equipped to do that. In terms of treatment, we have explored many different treatment options. And again, we're learning from our colleagues all over the world, including our colleagues here in this country who are really targeting the things that we know and caring for patients. We also have several studies going on at Stanford looking at treatments, as well as diagnostics, by the way. And we are partnering with people all over the country in terms of developing treatments. So if you have any specific illnesses and questions, we will help your teams care for you. And we will do everything case by case and let you know what the best treatment is as you would need that.
Great. Thank you, Dr. Gans. Thank you, Dr. Chen. Again, I'm so grateful to have you on our panel today, providing such valuable information for our IBD community. So thank you again.
To follow up on that, can I ask quickly, would you, Dr. Gans and Dr. Chen, mind sharing with our families a little bit more about how we determine who is getting tested? For example, people coming into the hospital, et cetera, and our general guidance for people who are having viral symptoms at home.
I don't know if Sharon wants to take that one, but in general, we would like you to partner with your either primary care or your IBD specialist to determine who needs to be tested and who doesn't. In general, if you have just what looks like a cold and you're otherwise stable and fine, we really, really are encouraging you to stay home. We now have the capability actually to do what we call as a telehealth or remote visit. So if you feel that you call into your provider and there needs to be an assessment, which they will tell you, then that can be set up. But I think that I would urge people to the best of their ability, stay put. As I would like to urge you, most of our pediatric patients have very mild disease. And so if you fall into that category, feel free to alert your physician since you are somebody we would be interested in closely following. But please stay home and we will partner with your physicians to help you if need be.
Great. Thank you. Thank you, Dr. Bensen, for adding that. That was a great question to elaborate on. So we're going to kind of keep moving in terms of the types of questions we received. A lot of them fell into the category of appointment scheduling and procedures and infusions and questions very relevant to our clinics. So while we're going to move on, if there are additional questions people have, you can again message to the chat board, and as we're able, we can answer. And absolutely, Dr. Gans, Dr. Chen, if you're able to stay on, please feel free to jump in at any other point. But again, we really appreciate your input and valuable expertise in the area. So Kaylie, I'm going to pass this to you now to talk a bit more about appointments, scheduling, clinic, and Kaylie has read over the types of questions that have been sent our way and will provide some valuable overview and recommendations there. Kaylie, you're on mute.
Okay, sorry about that. I keep muting because there's dogs barking and stuff outside. So I'm going to go through just 3 major categories. The first is GI clinic accessibility for appointments during the shelter-in-place mandate. So just so everyone knows, all of the clinics at Welch and our satellite locations in Sunnyvale, Capitola, and Los Gatos are open and staffed. However, most of our routine clinic visits are being converted to telehealth, either through MyChart, WebEx, or Zoom meetings. And our medical assistants have been great in reaching out to the families to set that up and walk the families through the process of how to link on. For any patients that need to physically be seen or assessed, then we will accommodate an in-clinic visit using hospital and CDC precautions to keep you and us safe. We're all working at different locations and adapting to this kind of new online workflow. So just please be patient with us if we have connectability problems. We will work through it. To reschedule or schedule appointments, you would follow the same procedures as we always have by calling the scheduling line in the GI office at 650-721-2250. We'll send this to you through a document later on. If there are any acute events, then it's the same way. You can call us at that line and leave a message with the GI nurses who check the lines every hour, or you can get a hold of your physician or nurse practitioner in the regular way that you do. Remember that my chart messages are not for urgent responses, okay? So expect like a 24-hour turnaround. Often we can get through them much earlier, but they're not for urgent messages. If it's after hours, you call our page operator and you would ask for the GI fellow on call. And then we're going to move on to regarding procedures. Lots of people have asked whether or not routine procedures will be moving forward, and whether or not we do will be decided on a case-by-case basis. For routine procedures that can be pushed out for 30 days or more, then we would encourage rescheduling. And our scheduler, Italo Gomez, is working hard to do that. If there are any urgent cases, major IBD flares, then of course the cases will be accommodated, and our surgical and procedure units are open and staffed. And again, we will take every precaution to keep you and us safe. And we would encourage that when you go to a procedure, make sure it's just one healthy parent and the child. And then regarding who to contact and when, we've had a lot of questions about whether or not you should contact your primary care doctor or your GI specialist. And the answer is, for IBD-related issues, just as always, or for any questions related to medications for IBD or treatment, of course, contact your GI provider. For general questions about colds and respiratory symptoms, like Dr. Gans had said, contact your primary care provider. If you suspect that you have a COVID or your child has a COVID-19 infection, then we would recommend that you quarantine the patient and the entire household and all contacts. Then you would call your primary care provider and your GI provider, and we will be in touch and discuss each case by case, and then develop a plan as they come for every patient. I hope that answers your questions.
Thank you so much, Kaylie. That was extremely helpful, and I know answered many of the questions that came our way in the last few days. And to elaborate, to kind of keep going on this topic, I'm going to pass it now to Dr. Bensen to talk a bit more about medications and treatments and questions that have come up about, should my child stop their medications in light of the COVID-19 infection? Should we continue therapy plans? And I do see a question from Scott Simpson, and thank you for asking that. We will also be talking about the Infusion Center and specific recommendations there following Dr. Bensen. So that is coming, but thank you for raising that. So Dr. Bensen, please take it away with medications and therapy plans.
Yeah, and so the very brief answer is no, we don't recommend stopping medications, but because it's important to continue to control IBD well, even in this period of time. And overall, again, we're not seeing increased rates of serious illness on people who are on infliximab or adalimumab or immunomodulators or any of our other medications. So overall, in general, we and our IBD community at large recommend that you continue on your IBD maintenance medications. It is also a general principle that we have that in order to reduce the side effects of medicines or the risk of infections, this kind of infection or any infection, that we would try to have you on as little medication as we need to fully control your Crohn's disease or ulcerative colitis. So if you can always reach out to your provider and we can have a conversation, are there any opportunities to reduce your medications if you're on more than one, or if you're on steroids, could we move a little faster, can nudge us to continue to reduce the dose. But in general, it's important to stay on medications, especially because if we go off of medications, we have a risk of having a flare. And having a flare, then there's an increased need to come into the hospital or into the lab, of potentially needing to increase medications, treating with steroids or treating with other things that will further suppress the immune system. So by staying on medications, we can continue to have good control of Crohn's and UC and help prevent the need for potential additional exposure or help prevent the need for escalating medications to treat that, and also help keep you or your child well. The other part of it too is that we always think about biologic medications, so our Remicade, our Humira, Entyvio, et cetera, that if we stop those medications, one can develop antibodies to them, and then potentially they may not work as well the next time around when we decide we do want to use that medication. And some of those medications also stay in one's system for a long time. That was another question that had come up. Our immunomodulators like 6-MP, azathioprine, and our biologics, like especially things like Remicade and Entyvio, they do stay in the body for quite a while, weeks to potentially months. And so by being in your system for a long time, not giving a dose today doesn't necessarily change your risk of infection tomorrow, but not giving doses as they're due can affect our control over IBD. All of that being said, if you're sick, as always, be in touch and let us know so that we can determine, is this the right time? Generally when people have fevers, we think about your medications and do we need to hold your wait to give your dose until your body has recovered? Do we need to look and evaluate infection? Do we need to reconsider, is it a good idea to come into the infusion center? Which in general, certainly the answer is, if you are sick, the answer is no, and not a good idea to come to the infusion center. So the key part there is stay on our treatment plan and be in touch with us if you have any symptoms, and we need to consider whether to wait a few days or a week or some period of time until the next dose is due. Another question that had come up relating to medications is also about refills of medications and what do we need to keep on hand. In general, we are not aware of any medication shortages related to the outbreak. The thing we urge the most is just to make sure that you don't wait until you're running very low on your medications to get refills, just because pharmacies or clinic might be a little slower than usual in terms of processing routine requests. So make sure they have at least a couple weeks of medication on hand at home. We're happy to write prescriptions for a 2 or 3 month supply if that is something that your insurance will cover for you. Some insurance is being more lax about what they will refill, but we don't think you need to stockpile a large volume of medications at home. There do not seem to be, again, medication shortages relating to any of our IBD medications. Just make sure we have it at home in case you are to be, someone is sick and needs to be quarantined at home, that you have medication for at least that 2-week period available to you. And also general things, for example, like Tylenol, oral rehydration solution, etc. Another question that had come up is about supplements or additional medications to help prevent more severe illness. There is no medication out there that can prevent one from getting this viral illness or others. Vitamin C, vitamin D, those are fine to take if you choose, but they are not necessary unless you want to give those.
Can I just say, can I add something?
Please.
Of course.
Again, I'm hearing a lot of anxiety regarding whether this infection in particular is going to cause more severe disease in your child. And I just really want to urge people that we're really not seeing that. If it's something that we're seeing, we will certainly alert our partners here and the care teams. But I wouldn't, outside of what Dr. Chen said about washing your hands, that's the most important mechanism for protecting yourself from being healthy. So I just want to reiterate with some of the questions about how do you prevent more severe disease. We're not in that category at this point. So I just would like to tell people to not worry about that.
And there is one extra thing that I would like to add. That's about steroids, or if your child is on too many medications, the best thing is to talk to your GI provider and see if some of the medications can be, titrated down or decreased.
And on that same general topic, especially regarding steroids, if you are on steroids, it's important to come off of those slowly and not to abruptly discontinue, especially if you've been on for a longer period of time, because abruptly discontinuing steroids can lead, if you've been on it for a while and your body is no longer making its normal steroids, it can affect how your body responds to stress, and so can make it harder for your body to maintain blood pressure and for you to respond to a stress such as an infection. So it actually can make it harder for your body to cope. So make sure we're communicating, especially about a medication like steroids. And also in terms of, besides washing your hands, other important things at this time is, eating well, just, obviously with the limitations of being at home, making sure to get good sleep, and general taking care of yourself are the best important things for us to do at this time.
May I add, what we have been seeing, it's really wonderful to have people get outside and see the sun and do some things. What we're really urging still is, we've seen a lot of impact in our parks and other things like that. That's not really social distancing. So try and find ways to get outside where you're still able to enjoy what you like to enjoy. And it's so important to do that, get exercise, but really do try and not do a lot of social gathering, which is what continues to happen.
Thank you for sharing that. And would you continue to recommend the 6 feet rule, Dr. Gans? Another thing that has come up, just to get your input on that.
So the 6 feet rule is very important person to person, but this virus, like again, all viruses, lives on surfaces. So I think the more and more you're not in control of sort of who's also touching surfaces, the less and less we understand what you would be exposed to. So that's why hand washing is the most important thing. But if you have to be in a situation where there's other people, 6 feet is what we're recommending.
Thank you. And Dr. Bensen, do you want to finish with the procedure related questions? And then we'll move in with Dr. Bass on the infusion related questions. I see quite a few questions coming in about infusions and can parents go in and precautions, and we'll absolutely be addressing, Dr. Bass will be addressing all of that in just a few minutes.
I'm also happy to mention procedures. Kaylie mentioned both our endoscopic procedures and our radiologic procedures. We've been reviewing them every week and doing only those that we think are essential. And the main reason to do this, actually at this moment in time, is preserving protective equipment for our colleagues in the adult hospital who are seeing some COVID cases. That's really the main reason. We don't have a huge burden of this disease in the children's hospital, but we are trying to help make sure that we can keep our adult colleagues as safe as possible. And so that's a major driver in our emergency room. So we've sort of routine procedures. We've been rescheduling usually more than 30 days because we're not for sure how long everything's going to continue. But any urgent procedure that needs to be done is being done. And we're discussing them very carefully on a case-by-case basis, because sometimes the urgency is difficult to ascertain versus the risk. I'll just continue on to the Infusion Center. Again, we suggest everyone keep their appointments, keep getting your infusions. And I would say for now, our recommendation is people keep getting them where they have been getting them. We don't know that there's any advantage to a home infusion versus coming to our infusion center. At a home infusion, we'll have a nurse who's been in multiple households that week. We just don't have any data on it. And during this stressful time on our healthcare system, sometimes switching things around may not even be possible. I'll say our infusion center is open and operating at a pretty normal level. Everybody who comes into the hospital is screened. We ask that you don't bring the whole family for the infusion. Again, one adult, if you have an 18-year-old patient, they can come by themselves. We don't want anyone who has symptoms of sore throat, fever, cough, etc., to come without contacting us first. We're doing these on a case-by-case basis, and we will evaluate each situation. Again, to reiterate what Rachel Bensen just said, for some people, delaying an infusion a few days is no big deal. For others, it's actually a very significant decision. So if your child is fine and your household is all feeling pretty healthy, we would really like you guys to show up for your infusions and stay healthy. We don't want any extra burden of people having flares again while the healthcare system is stressed, and we have no evidence, and I think Dr. Goyal will talk a little more about this. We don't really have any evidence that any of these medications are putting you at more risk. So we're hoping everybody will keep staying healthy. Thanks.
And I just wanted to add really quickly, I saw there was another question about precautions when you're coming into the infusion center right now. So besides, not, discussing with us if you have symptoms, they're screening at the front entrance of the hospital to ask people if they have symptoms. They have hand sanitizer. They're asking everybody to clean their hands as they come in at different stages. Parents can still be there. A parent can still be there with their, their child, of course, but their siblings, as I think was mentioned a little bit earlier from Kaylie, siblings cannot necessarily come into the hospital. They're restricting all visitors under the age of 18, and they're limiting the number of caregivers that can be with the patient, just to, again, reduce traffic in the hospital. So I would suggest having one parent and, your child there, and other than that, not specific other precautions. In terms of if there's a recommendation about wearing a mask, they'll give you one at the entrance. Our recommendations about masks are continually evolving, but at this point in time, there's not a recommendation to come in wearing a mask.
Great, thank you, Dr. Benson, for answering that question. So one question that's come up, I want to make sure that we answer, Dr. Gans and Dr. Chen, in terms of the mild corona disease in older teenagers as well, in terms of risks for older teens with IBD. Would it follow the same? Would your response be the same?
Yeah, thank you for that question and making that distinction. It is true that most of the disease that we're seeing, as infrequent as it is, and really not reported necessarily in the IBD populations, is in our teen group. There might be a lot of reasons for that, more related to the lack of social distancing sometimes in those populations. But it is true that those have been the cases that we have seen. Again, that doesn't mean there's severity of disease. And so I would really just urge you, again, good hand wash, no different recommendations for older teens or older children in those teen years to do anything different than young children. Because again, we're not seeing the severity there. We are seeing more cases, and just follow the practices that we have talked about.
Great, thank you.
And this is Dr. Chen. I'll add that of the published data from the experiences in China on the children age group 0 to 18 years old, the predominant presentation is of a mild infection.
Great. Thank you, Dr. Chen. And another question for both of you is the question about potential treatment from Ibd. Can you guys see that question?
I think it's on hydroxychloroquine.
Yes, exactly.
Yeah. Thank you for ever brought that up, since this is a treatment or a medication that has been circulating in the in the news and our leadership in this country. I would really urge people to leave treatment to us. There's a lot we're still learning, and we really are keeping, again, abreast of all the science that there is, while we have been able to learn not only from our colleagues, but also from some of viruses that are in the same family as this virus. So we are looking at the science, and we are looking at what clinically, so that means in the person, works in all these instances. And so I would urge people not to make any treatment decisions on their own. All of these medications have side effects, and therefore we are working very hard to come up with the most effective and safest regimens that would work in any part of the spectrum of this disease. So as I said earlier, we have studies even going on at Stanford looking at treatments. None of the current treatments that are actually circulating are 100%, and we feel like we could probably do better. We're exploring that, and we know that we have those medications that are currently known to be effective against the virus in the dish, and in some small studies. We are well aware of all of that, and even more medications that we're looking at every day in different ways. Also, it's not always about a medication treatment. There's a lot of other supportive treatments that work in conjunction with medications that really are important for viral illnesses. So I would just urge everyone to please have confidence in us. We're really studying this carefully, and we want to make the best decisions for every person. If you have a particular question, again, about becoming ill and what needs to be done, please reach out to your caregivers, and we will be helping.
Thank you so much, Dr. Gans. This is incredibly helpful. So I know other questions are popping up, and some of them will actually be answered in this next section. The other section that we received questions on was sort of how COVID impacts IBD in other ways. So things about likelihood of infection, symptoms in IBD patients, what to do if a patient or family member is ill. So we will be moving into that section now, and Dr. Goyal will be leading us here. And again, other providers, Dr. Chen, Dr. Gans, please feel free to add and jump in as you would like. So Dr. Goyal, I'll pass it to you for the next section.
So what I'm talking today might have already been behind the ball, because by tomorrow or day after, the number of cases we know about might change dramatically. How do I know these numbers? There is currently an effort going out throughout the world where wherever an IBD patient is getting COVID infection, we are putting it as a de-identified information in our databases. And this effort collectively throughout the world at present, as of this morning, we had 87 patients with IBD who also got COVID. And 23 of them were in America, 3 in Canada. Most of them are from Europe, 54 of them, and then rest were in Asia. So what we know so far is of those 87, 5 of them did not do well. And of those 5, 2 were in the very high risk category with ages of 82 and above 90 years of age. And the rest, I think, what we can say at this point is the medical therapy is not really impacting the outcome. We do not have any data at present saying that if you are on this medication, your likelihood of not doing well is high or low. In general, as Dr. Bensen had mentioned, steroids are a little bit of a concern for us, but certainly there are patients on steroids, Remicade, and others who've done well. So just to give you an overall idea about from the medications, out of the 87 patients, 54 were on a biological, 17 were on immunomodulators, 7 were on steroids, and 5 were on JAK inhibitors like tofacitinib, and 17 were on mesalamines. And of these patients, about 75% continued the medication they were on, whereas 25% had to stop their medications. And only 19 patients, which is 20%, which is just like rest of the population, got hospitalized. 2 received ventilator care. And typically from the reports from Europe, 5 children which they've reported all did really well. They did not need hospitalization or other care, which we've already learned about from our other colleagues. And then any other questions from?
I just wanted to kind of follow up with what Dr. Goyal was saying, is that we're gathering data on children and adults across the world with IBD so that we can learn more about it. This data that we have so far is predominantly adults, because our adults are being tested and are coming into the hospital, and that it looks like our people with IBD in general are having similar kind of courses of illness as other people in their age group. And so in general, children are doing very well. Most are not hospitalized, and some adults, comparable to some other adults, are also having more severe illness. But that again, we're trying to learn from adults, and we're trying to learn from the experience of everyone around the world about how do children and teens and young adults cope with this disease, and 2, how do people with IBD and people on particular medications have, does it seem like it impacts their disease course?
Dr. Bensen, thank you for that. And then one specific question came up about GI symptoms, and whether, you spoke to this a bit, whether we would expect our IBD population to have more of the GI symptoms that are present with COVID-19, and how long these might last, given that our population of IBD patients already have GI symptoms.
And
so there is, sorry.
Oh, sorry. Can I just say one last thing still relating to the last question? We're also gathering information similarly to in IBD, but in other kind of populations of kids that are immunosuppressed and take similar medications, that we're learning from them as well. So just like we've learned a lot in our IBD world from rheumatology, and because those kind of kids and adults take similar medications to us, we're also learning from kind of different populations, and there's efforts to track information across all of these kind of patient populations. And that's where, again, having our infectious disease docs partnering so closely with us helps, because they're connected not only with us, but they're connected with the other patient populations that who take similar medications and may be impacted in a similar way. And then we as IBD doctors are connected with our IBD networks. So we use all those networks to learn as much as we can all together.
Thank you.
Thanks. And sorry, in terms of that.
Regarding the next question about GI symptoms, so there are only a couple reports about GI symptoms related to COVID. And what they found is that the most common symptom is probably loss of appetite and also loss of sense of smell. But there is about 15 to 20% patients who may have abdominal pain, nausea, vomiting. But there is no report yet showing that IBD patients are more susceptible to getting these symptoms, or whether they will have it for a more prolonged period of time. We are yet to learn about that.
Thank you, Dr. Goyal. That was very helpful, as I know that came up earlier today. So thank you for asking that question. And along these lines, wanting to shift now to, what happens if your child or a patient does get ill, or a family member does get ill. And I will be handing that to Dr. Bensen and our other providers to chime in on as well. And Dr. Bensen, I'll pass it to you now.
In general, similar to what we've been saying so far, that we expect that most of our kids and teenagers will do well, even if they are exposed to this infection. And the key parts of treatment at this stage are, supportive care, so drinking lots of fluids. It has been noted in some that people can have a diminished sense of taste and smell and a diminished appetite. So really, which kind of can make drinking fluids and eating a little bit more challenging. So encouraging good hydration, making sure, keeping an eye on symptoms. In general, for those with IBD, we recommend Tylenol as our first line medication for fevers and pain over ibuprofen, partly because ibuprofen can potentially lead to a flare in IBD. So it is the same here. I think that the data is still very preliminary about the potential impact of ibuprofen on COVID anyway, but since it's our general first line, I think we'd start with Tylenol. And things to look out for that would require a trip to come into the hospital are the same as for anyone else. So shortness of breath, lips starting to look a little bit blue, a fever that's just not going away after 5 days, 7 days. Sometimes people can need a chest x-ray to look for pneumonia. Dehydration, altered mental status, so being sleepier or not as responsive, not able to speak in full sentences, things like that. Those are all generally not so subtle, so those are all things that you can be reassured when you don't see those kinds of signs and symptoms, and if you were to see them, they need really urgent evaluation in the emergency room. And we're trying to, again, to keep folks at home and out of the emergency room unless you are really sick, both to reduce your own exposure to other people who are sick, but also to keep the emergency rooms as available as possible to take care of people who are sick.
Great. Thank you, Dr. Bensen.
And sorry, and on the subject of what if a family member is sick, if a family member is sick, just again, as everyone else, so recommend trying to isolate from that family member as much as is possible. So if a family member is sick, trying to keep that family member in their own room, separated from, from others that they could expose, and trying to clean as best you can, clean surfaces, clean doorknobs, clean anything that they're using to eat from, clean the bathroom, etc. And as we mentioned earlier, if you're concerned that your child has had a clear exposure or their child could have COVID, please just be in touch with us and let us know. And as currently only people with either who are more severe illness are being tested, if that has changed, we will be aware and we can let you know.
Great, thank you, Dr. Bensen. And to Dr. Bass and Dr. Goyal and Kaylie, anything else you'd like to share about the additional precautions for patients with IBD, patients who are immunocompromised? I know we received a few questions there.
Yes, I think there were some questions about traveling and with IBD. I feel that at the present time, personally, I would definitely avoid all non-essential travel. If you did have to travel, follow the guidelines. Again, I don't know whether there is any role of using a mask prophylactically, but if you see a person next to you who's coughing and sneezing, and Dr. Gans and Dr. Chen can probably tell us better about what sort of precautions are they recommending for patients who have to travel, but just be very, very careful.
And Dr. Gans, as you answer that, could you also answer that's come along as being out in public if you're immunocompromised in terms of going to the grocery store, in addition to what you had said about the 6 feet rule, if there's any other information for this population?
Sure. Yeah, thank you for that, and thank you, Dr. Goyal. I think those are very good recommendations to limit your travel to all essential travel. I would say if you really need to go somewhere, go by car if you can. Air travel is obviously, like it is at any time, just a high-risk situation where you're coming to contact with surfaces and people that you have no idea what their story or exposure is. So whatever you can do to not travel. In terms of going to the grocery store, other things, I would suggest that households sort of designate people who go and do some of these essential activities. I would say, if possible, I would not go in groups. I would think an individual needs to go to the grocery store, and that's considered an essential activity. And if you do, I would just be, I mean, I think what we're all saying is be aware of your environment, be aware of distancing yourself from other people in those environments. When you go, you should wash your hands when you come back to your household so that you're sort of in control of what your household is being exposed to. You know, this is not really, the way that this circulates is not really different than other viruses. So do what you normally do, practice safe living, and I would say more attention to surfaces and doorknobs and things like that are sort of what we're just alerting people to who are not able to shelter in home. But I would just restrict sort of the activities that people in these households, particularly people whose immune systems are to maybe what they typically restrict themselves from.
Great, thank you.
Can I add one more thing? Is that okay?
Please do.
So I just want to add on to what Dr. Gans said, and then add a bit of what Dr. Bensen talked about. I think in terms of cleaning, you can make yourself completely, totally crazy about this. So I would say two things. Number one, please wash your hands. If you're going, anybody in the household going to the grocery store, if you come back, please wash your hands. And that goes for any time you go out of the house and then come back in, and then also within the house, especially if there is someone sick in the house. So Dr. Bensen talked about some things to do if you have a household member who is sick, and I agree with those recommendations. But what I would say is focus on what's called high touch places. So Dr. Gans mentioned doorknobs, counters, or handles, or TV remotes, or keyboards, or computer mouse. And so those things that people touch a lot, you can focus on those, but the most important thing is wash your hands.
Great.
And I saw one question about having IBD and asthma together. So I just don't think that having IBD and asthma increases your risk, but depending on how severe the underlying asthma is, that probably would change your risk category. But I don't think the combination of asthma and IBD is particularly putting you at risk. Any comments, Dr. Gans or Dr. Chen or any of my colleagues?
I think, again, underlying lung disease in older people is something that has been associated for all viruses as something that puts you in a category for potential more severe illness. I think, once again, what we'd like to stress is we're really not seeing this in children, regardless of the large population of children who have asthma. So I would just say what you typically do with your child who has asthma, that is probably what you're going to see. I will also let you know that there, as we said earlier, there are lots of viruses that are circulating right now, this being one of them, but actually in the minority of people that we are seeing with all respiratory illnesses presenting to the hospital. This one is only even 8 to 10%, so a small proportion. So there is a big chance that your child could have a virus that would cause their asthma to flare. And I think it's very important to do what you would usually do for your child with that. The combination does not seem to be that combined with other things. I think each one of those has their own sort of risks, and I'd follow what you typically do. This does not appear to be, again, more important for children.
Before we had some other questions about school, and I wanted to address that because we have a lot of school age children in our IBD center. So I'm just going to take the liberty of answering those questions about when school resumes, should my child with IBD go? And I think as a group, we do not have a recommendation about that yet, because in several weeks, things can completely change. So I think if anybody has that question, please stay tuned. If anybody has a child who has IBD and has to go to work for whatever reason, for essential activities, just if you need a letter from the IBD team to show to your employer about exposure or minimize the exposure at home, please let us know, and we will consider every case and help you with these letters as they are needed.
Thank you, Kaylie.
One more quick question that I clicked off that I would answer, meaning to answer it privately, but yes, the Infusion Center has vascular access teams. Yes, they're still there.
Thank you, Dr. Bass. Yeah. And I see we're a few minutes over, and one thing, there's of course, I know probably hundreds of more questions, and speaks to the really big take home of that we are here for you. All of your providers are accessible via MyChart, calling clinic, and between nurses, our nurse practitioners, our MDs, myself, psychology, social work, dietitian, we're all here, and we want to answer your questions and provide as much help and support as we can. As one of my colleagues said, you may hear a barking dog, you might hear noises in the background, but we are here, we're doing telehealth, and you can get in touch with us at any point. And before we end, I do also really want to recognize that various people have reached out, sent questions about, this is a really stressful time for me and my family, and what can you suggest for support and resources? And so we will be posting, there's been lots of wonderful resources sent out nationally in terms of stress management support. I've also sort of gone through some of those lists, edited them, added some more resources, but I think just for everyone to know that how normal that is, that if you think about COVID-19 coronavirus and sort of the psychological impacts of that, we're seeing that manifest in terms of increased stress and anxiety. Normalizing it for your children, your younger children, your middle school age children, your young adults, your teenagers, that this is normal. And it's incredibly important to talk about, to talk to your teenagers, to talk to your children, see how they're feeling, answering their questions. So communication is a big thing we're recommending, helping them get answers to their questions. So there's a lot of, fear out there in the media right there. There is rumors and there's misinformation being spread. And so helping them find the correct information, just like you're coming to the town hall, we're answering your questions, helping your children get answers to their questions so they do feel that they have an understanding, that they are more in control. They've gone through a lot of transitions recently between not being at school, not seeing friends and family. So it is very normal that their stress might be up and that a lot of questions might be arising. So we really do want to stress how normal this is to communicate with your kids, to help them find the answers to their questions so they can feel more in control. And also really balancing that communication about COVID-19 with shifting them off medical topics, having them be as much as possible in their normal daily lives, having a schedule with school and some exercise, as Dr. Gans mentioned earlier, of course, 6 feet away and, a bit more isolated than normal, but exercise in the backyard, the front yard, walking down the street. Also spending time doing fun and relaxing activities. So I will, of course, things like game nights or movie nights or virtual FaceTime, or there's a Netflix party where you can watch movies with friends. So there's all sorts of creative ways to keep our kids and teenagers connected, and adults for that matter, connected. So do check out our website. Megan will be posting some relaxation-based exercises that I've recommended in terms of breathing and relaxation, some yoga and other exercise tips, and other enjoyable activities, ways to access things that we can't access now, like national parks. So there's some pretty interesting links in there for you to check it out. And lastly, just emphasizing the importance of self-care for our parents. For adults on this call, parents on this call, your children live with you. They can pick up on energy. They can pick up with the energy locally, nationally, and at home. So just modeling good communication and self-care and thinking a little bit about what you talk about in front of your children, what is age appropriate, and what you might talk about after kids go to bed. So these are, I know, are very common sense recommendations, but I think really important to give some time to and think about. And if we can answer any other questions, again, we are here for you. So thank you guys so much for your time. And another question has come up about, are we doing this again? And thank you for that. We do want to hear from you. So we'd like you to email Megan Christofferson with feedback of, was this helpful? Would you like this again? Is this something we could offer on a recurring basis? We're absolutely open to that. I just want your feedback. So I will pause before ending for my colleagues to share any last thoughts and to thank everyone, our IBD team, our infectious disease colleagues, for joining.
Yeah, thank you for inviting. Yeah, sorry, Dorsey.
It's great.
I just wanted to say thank you to everyone for hosting this. I think it's so important. And I really just want to reach out to our families and say, we really are here for you. And please just try and take every day and have some fun. This is really an unusual time that we get to spend with our families. And what a lovely gift that is from our busy lives. And hopefully we'll keep you all safe.
Thank you.
Well said. Thank you.
Thank you.
Yes. Thanks very much. I was going to say, keep the bad jokes coming and wash your hands. It'll be okay. We're all going to be fine.
Stay healthy, everyone. Take care.
Thank you. Okay.